The Memorial Hospital is feeling the pinch of treating COVID-19 patients. Hospital officials told us they're not worried about more people testing positive, but they are concerned more people will be needed to be hospitalized. If that's the case, they may not have enough staff to go around. Sammy Steele joins us to explain why. Sammy.
Good evening, Crystal. Well, the problem is twofold. On one side of it, you have more people in the community testing positive for the virus. Right now, here at the hospital, there are 22 COVID-19 patients. And then on the other side of it, you have more hospital staff also testing positive for the virus. Right now, there are 41 employees from the hospital who currently have COVID-19, and the hospital is just trying to stay on top of it all.
Our staff live in this community. They are active in this community, and just like we're seeing with hundreds of new positives, our people are among those, and that's part of our realities.
A reality the hospital is trying to get a grip on.
So we're very concerned about it, not only because these people are sick and we want to be sure they get good care, but because we rely on them to care for others. And the fewer of them we have, the harder that is to do.
More staff testing positive means less care for patients. And that's the biggest fear for the hospital's doctors, nurses, and administrative staff.
So we've tried to be very diligent throughout the process about educating our staff. We require people to wear masks when they're at work, unless they're by themselves and effectively socially distanced. But we're not in control of their behaviors once they leave the hospital. They're going to behave just like other people in the community do, and we're going to be at risk for having some positive staff members.
Actively monitoring staff is one way the hospital is trying to fix the problem.
We're working with it, and the best thing is that our employee health team is on top of it. The moment anybody shows any symptoms, we get them tested, we get them out of the workforce, we avoid them exposing anybody else at work.
As for when they bring those employees back into the building, well, it's a pretty thorough process. They must self-isolate for at least 14 days from the onset of their symptoms, and then they have to go 3 additional days without symptoms or a fever. From there, they can return back to the building. Reporting in Midland, I'm Sammy Steele. Back to you, Crystal.